most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
This is an introduction to the complete program for treatment of hip pain. We'll talk about more of that at the end, what this all is, Brad. Right now, if you have hip pain, let's say you have arthritis, tendonitis, bursitis, muscle or tendon strain, some people are really surprised at how intense the pain can be. They think something's really wrong with their hip.
Yep.
And, our approach is that something in the hip is not working quite right or moving right. Now, the exception is to be if you had an injury, like you
Right.
fell.
If you've hip fracture or you had a hip replacement,
Right.
then these do not apply. You gotta
Right.
go what the doctor has given you for precautions and instructions.
So our goal with this program, all these series of videos, is to get your hip working right and moving right. That's the first goal. The second goal is to eliminate or decrease the pain makers in your life. And
Pain makers.
Yeah. We want to explain what that is, Brad?
So that's any activity or posture that you find irritates your hip or makes the pain
Yeah.
go up. So if walking up steps irritates it, you need to change how you walk up steps, and we go through options for that. Or maybe sleeping irritates us. Maybe it's a posture issue. We go through a number of options on how you can change your posture while you sleep so you don't wake up with a sore hip.
Yeah, and the thing about pain is, once you get it shows up and it's being perpetuated,
Yeah.
it doesn't calm down.
Right.
Your nerves become more sensitive and they react to pain easier.
Yep,
So,
it becomes an escalating
yeah,
problem.
vicious circle, I think they call it, Brad.
Vicious.
Yeah. All right. Third goal is we want to strengthen your hip and keep it in the correct position so that it will remain pain-free despite the demands of your life.
Right, you bet. So, yeah, it's always an important component. All three of these all work together.
Now, we do recommend that you probably see a doctor for your hip pain so we kind of know where you're going from. Because, like, number one, the hip pain could be coming from your back.
Right.
Very difficult to tell sometimes.
And it's not even, it's whether you're a doctor or a therapist, we struggle with that at times.
Yes, we do.
Because the symptoms are similar and they cross each other.
Yeah, or the hip pain could be coming from the knee, less likely, but
Yeah.
it's not as much. Number two, if it was from a fall or trauma, then you definitely need to see a doctor because
Right. You've got to make sure there isn't a.
you could have a stress fracture in
Yep,
there if you're doing a full
exactly.
fracture. And number three reason to see a doctor, it could be a medical issue. You might have
Right.
an infection or
Exactly. Yeah.
not common, but osteonecrosis or
Oh, sure.
dislocation.
Yeah.
Could be a lot of things.
There's a lot of little things you want to
Yeah.
rule out, and typically that happens.
Yeah. All right. Our philosophy with this program, it's self-help. It's up to you. There's no magic pill. There's no magic shot. There's no magic surgery. We're going to show you what to do, but you got to do it.
There, occasionally, some of these exercises will really offer some immediate relief. Others, more commonly, it takes some consistent stretching over a period of days or a week or two before the relief comes.
Yeah. The second part of our philosophy, Brad, is the body wants to heal. The body has amazing capability of healing.
Right.
And if you allow it, create the environment where
Right.
it can do so, you can often, it doesn't matter if you have arthritis, no matter what you have,
Mhm.
it can get a little bit better, and certainly the pain can get better.
Right.
So-
Yeah.
All right, so you must follow our suggestions and exercises. I always tell Brad, and I have had this discussion before where I'd get a patient, and I could almost tell right away if they're going to get better because, some of them are really compliant and
Right.
they follow every step and they get better.
Yep. They're motivated. They do what we ask them to do, and
Yeah.
they come back and they say it's not working. We make modifications and then get it to fit in so that hip starts to move with less pain.
Yeah, when they come back and haven't done one exercise, haven't done one thing, one change we recommended, I'm like,
It usually doesn't get better.
you're wasting our time. I
Yeah,
mean, and you're wasting your time. So,
Right.
Again, we don't believe in having someone do something to you. We want you to be taking control of this. So, like,
Right.
I'm not big on anymore like doing modalities on people as much. You know, like
So ultrasound
Yeah.
and things like that, where it was in therapy, I think is just less popular overall compared
Right.
to 20 years ago.
yeah, yeah, or like you know, you can put heat and ice on it, but you can do that. I mean,
Right.
we want to be your consultant, basically.
Right. And we're assuming that's why you come through YouTube to see us.
Right.
Otherwise, you would go to a doctor and see a therapist or a chiropractor, and they would, you know, push on you and mobilize you and do things that they
But if you
can-
don't take care of the problem that caused the problem, it's just going to flare up again.
Exactly.
You can't keep getting manipulated and hope it's going to stay away.
Right.
So this is the point where we're going to talk about where do you find this complete program, Brad? So you go to bobandbrad.com.
Where else, Bob?
Yeah, where else? You go to bobandbrad.com, go to the program section, it's a heading, and under there you'll find a bunch of programs that we have, one on hip pain. Go to the hip pain one, and you'll see lots of videos there. And you don't have to watch each one.
They're all about hip, and they're going to have titles. And if you say you want your hip stronger, there'll be a few videos just on hip strengthening. Click on it, watch a video. They're usually about 10 minutes long, plus or minus. And the big benefit about this program section that is unique to us, I believe, is we have a PDF printout, so you can print it out. It'll give you a review of the whole video, pictures of the exercises, so you don't have to go back and look at our faces
That's right.
too much if you can't remember the whole video.
Probably get nauseated when you do
Yeah,
that.
that's
So,
right.
yeah, and this all costs zero.
Not
Yeah,
even an email.
Yeah, we don't even want an email from you. This is our gift to you.
Right.
2021, our gift.
Wow, it is 21,
Yeah.
isn't it? Yeah.
All right. Thanks
Take care.
for watching.